Good afternoon. My paper is Genie in a Bottle, Reversible Nutritional Optic Neuropathy in Northeast India. I do not have any financial disclosure in this presentation. Of the various colors of Northeast, the Mar, Mizo and Naga hail from in and around Assam. I hail from Kachar, so I get a lot of these patients. The background of our study is India has the largest market of smokeless tobacco, and incidentally, Mizoram has the highest amount of tobacco consumption. What is not known is the liquid entity, tobacco entity, and its ophthalmic sequelae. The purpose of our study is to report reversible nutritional optic neuropathy in 43 young and healthy patients belonging to the indigenous tribal community of Northeast India. They all presented with diminution of vision in both eyes, and they gave history of liquid tobacco intake. It is a retrospective case series. Detailed medical and dietary history was taken. Clinical evaluation included color vision, visual fields, and the OCT studies. Demographic profile was taken into consideration. Duration and frequency of liquid tobacco use was also noted. So what is this liquid tobacco? I had seen patients sipping this brown-colored fluid from a bottle in their hand. I was really intrigued. The local name is Tuibur or Hedakfu. It is a form of tobacco water, very popular in northeast states of India. It is a part of their social customs. It has a wide culture and social acceptance, so much so that it is as common as tea or coffee. And they have a misconception that water purifies the tobacco. I visited a Mar village to find out the production chain of this Tuibur. Here the tobacco is dried up and then it is set to fire in these earthen pots. The pots are connected to glass bottles, and with the help of a hand pump, the smoke is infused or percolated into the fluid till the time the fluid is supersaturated. Then a cloth filtration is done, and then this is the final product, which is the brown colored liquid. So what is the mechanism of toxicity stripping? Polarimetry of Tuibur has shown the presence of heavy metals, myosmine, carbon monoxide, and cyanide. All these cause mitochondrial DNA damage, resulting in reduced mitochondrial respiration, reduced ATP, increased oxidant stress, which finally causes demyelination. All the patients were started on vitamin B complex. Along with methylcobalamin, they were advised to discontinue tobacco use. Out of the 43 patients, 83% were female. Mean age was 29 years. Tuibur intake was mean of 7 years. The ethnicity showed 61% of them were Mar. Another 30% belonged to Naga, Kuki, and Mizo community. These are some of the cases. The first case here, normal looking fundus, normal OCT RNFL, but in the 30-2 you will find central scotoma, the first figure at presentation, and then after 1 month of treatment, central scotoma comes down. Another case presenting with temporal pallor, RNFL showed some temporal RNFL thinning. Again, central scotoma, and at the end of 3 months you can see total disappearance of central scotoma and vision also improving remarkably. So the vision, logMAR vision at presentation and after 3 months had a statistically significant improvement in the vision. The beneficial effect of vitamin B complex with B12 is because of conversion of free cyanide to cyanocobalamin. All 43 patients who presented with bilateral diminution had statistically significant improvement in visual acuity and visual field indices. As you can see here in the visual field index and the pattern standard deviation at presentation and at 3 months of presentation, the difference is statistically significant. Though there has been some studies of Tuibur and the connection to stomach cancer and some local studies from Manipur and Mizoram, this is the first ever study linking liquid tobacco or Tuibur to toxic nutritional optic neuropathy. We conclude that nutritional toxic optic neuropathy can be caused by a multitude of agents. Mainstay of treatment involves definitely replacing the deficient nutrients. Eliminating the offending toxins has to be done, and it is very important to consider contributory social, cultural, and dietary practices. Thank you very much for your kind attention.